Okay, so now we're going to inspect your abdomen. First, we're just going to look at it to make sure that it's symmetrical, it's even, we don't have a lot of distension, or we don't have visible peristalsis that we can see. We'll look at the skin, make sure it's not really taut, and we'll look at your umbilicus and look for any pulsations around there. All right. Next, we're going to want to auscultate it. Listen for all the vowel sounds before we do any palpating. Okay. And next, in this assessment, we'll listen for vascular sounds. So listen. Okay. Everything sounds normal, so we'll move on to percussion. So we're going to percuss and look for the borders of the liver and then the spleen. We'll also just percuss over the abdomen to make sure that there isn't any high-pitched sounds associated, with air or any, dense sounds. Could be a bowel obstruction. Here for the spleen. Okay, so now that we're done with percussion, we're going to move on to palpation. So first we'll start with a light palpation, just so we don't hurt the patient at first, get them a little more comfortable with the touch. Okay, any pain?
No.
Okay. So now we'll go and do the deep palpation. This will be to feel for any lumps, nodules, just abnormalities in the abdomen. Any pain when I push harder?
No.
All right. So now that we've palpated the abdomen, I'll palpate the liver. So you want to hold one hand under the patient and then use your other hand to palpate under the ribs, looking for the liver. In most adults it's not palpable. Any pain?
No.
Okay. And then you would also palpate the spleen. Any pain there?
No.
Okay. Also move down to the kidneys. Palpate for them. Alright, and then I will feel to the side of your umbilicus to feel for an aortic pulsation. Okay, and that would be the end of our abdominal assessment, unless the patient needs the abdominal reflexes done if it's indicated. In order to do that, you would just take an object and we'll slide it gently across the patient's abdomen to note any of the reflexes. Alright, so now that we're done with the abdominal assessment, we would move on to the inguinal assessment. However, for this video, we're not going to do that assessment. If you were, you would want to palpate the femoral arteries, one on each side, to make sure that there's adequate blood flow to the legs. And then you'd want to palpate the inguinal nodes just to make sure they weren't enlarged or swollen, to make sure there wasn't any infection or blockage in the lymphatic system. Alright, so now we'll move on to the lower extremities. You'd want to observe them. Look for symmetry of both leg size, like thigh size, also length of the legs. You'd want to look and inspect for any lesions, any sores that might be on the foot of a person, especially if they're diabetic. You would want to look for hair distribution. If a patient has poor blood flow, they would have decreased hair on their legs. Then you would want to look for their pulses. So I'll have you kind of bend your leg. There we go. So you would feel behind the knee for the top of the tail pulse. And you'd want to feel for the posterior tibial pulse. Alright, and then the dorsalis pedis. Make sure all the pulses are there so you know there's adequate perfusion to the lower extremities. Then you'd want to use the back of your hand to note the temperature of the legs. Once again, make sure it's not too cool, meaning there isn't enough perfusion. Also check to see if it's warm, could indicate, an infection. And then you'd want to take your fingers and just press the top of the shin to see if there's any edema. If there were, you would note how much there was on the 1 to 4 scale. Alright, so now that you're done inspecting the lower extremities, you would want to see, well, first we'd want to actually look between the toes, especially on the diabetic person. We would just check to make sure that there weren't any lesions in between the toes. And you do that for both feet. Okay. Next, we want to check the range of motion of the lower extremities. So, can I have you bring this leg up to your chest? Alright, and can I have you extend that leg up? Alright, and flex your foot. And your ankle. There we go, you can put that down. Now do it with the other side. First your hip, then your knee, then your ankle and your toes. Okay, so this patient has good range of motion. Then you'd help the patient sit up, because we're done with that exam, the lower exam. And we'd want to do the neurologic exam. So first you'd want to just look at the patient, make sure that everything is, symmetrical, that you're not having any symptoms of a stroke. Then you'd want to ask the patient, we're going to see if you can feel the difference in touch. So I'm going to ask you whether you feel something that's sharp or dull. Alright, this is sharp and this is dull. So without looking at it, I want you to tell me which one you feel, okay?
Alright. Sharp. Dull. Sharp. Dull.
Okay, good. Alright. And then you would kind of do that through their legs and their feet just to make sure they could feel everywhere. Alright. So then we'd want to check the patient's position. So in order to do this, you take the hand. Now I'm going to ask you whether you feel like it's up or down. So I'll move a finger. This is up. This is down. Alright, close your eyes please.
Up. Down. Up. Down.
Okay, and that's just to make sure the patient knows where their body is in relation to themselves. So you can open your eyes. Well, actually keep them closed. We're going to do one more. We're going to check stereognosis, and by this I'm going to put an object in your hand and I'm going to ask you to tell me what that object is, okay? Can you close your eyes? Make sure. Alright. Can you tell me what that is?
Feels like a pencil. Something long, cylinder.
It is a cylinder.
Flashlight.
Yes, it's a flashlight. Good. Good. So now I'm going to check your cerebral or cerebellar function. Can you bring your fingertip to your nose for me? Good, good. And now I'm gonna ask you to do another one to test that same function. Can you take the heel of this foot and slide it down your shin? Good. Can you do it with the other leg? Great. All right. At this point, I would test the patient's deep tendon reflexes, which we won't do in the video, but we check in the biceps, then we check your triceps, your brachioradialis, and then your patellar reflexes. So we're not going to do those right now, but if we were in an actual assessment. All right. So now the last thing we're going to, one of the last things we're going to check is your musculoskeletal system. So this is going to involve a little more interaction. We're going to have you stand up. I'm going to have you stand up. I want you to walk across the room. Well, we'll have you walk that way actually. So stand up and just walk and then turn around, and on the way back I want you to walk with your heel to your toe, okay? Alright, so you can get up for me and we'll have you go that way. Good. Now heel to toe. Good. Good. Alright, so now I want you to walk on your tiptoes that way and walk on your heels back. Good. Alright, so now we're going to test for something called the Romberg sign. What I want you to do is stand with your feet together and your hands at your side. Yes. So during this test, I want to just make sure that the patient isn't swaying back and forth a whole lot. Alright, great job. Now I want you to do a shallow knee bend, so we'll come over here so you have a little more room. I want you to go like this. Alright, and now the other side. Good. Alright. You can stand there. I'll just stand over here. Can I have you bend down? Like bend over to like you're touching your toes. Good. So now, when the patient's bent over, we would inspect their spine, make sure it's all straight. Okay, you can stand up now. And now I'm gonna check the range of motion of your abdomen. So I'm gonna hold here. I want you to lean back toward me. Okay, good. You can lean forward now. Now I want you to twist to this way. Good. Twist the other way. Now can you bend to your side, sorry. Yes, there we go. Good job, sir. Move over to that side. All right. You're finished, so you can sit again. So that would be how we would test their musculoskeletal function. They're simple tests, you know, but in somebody who doesn't have a lot of motion, they would help us detect some abnormalities. So now at the end of the exam, we would do the most invasive part of the exam, which would be the genital examination. We won't go through it on the video, but we'll talk through it. So if I were to complete this exam, I would have the patient stand in front of me while I was sitting on a stool. I would assess the penis and then the scrotum, looking for any lesions, discharge, any abnormal skin textures. And then I would move on to assess the testes and the spermatic cord, just to make sure that there wasn't any swelling, enlargement, no abnormalities upon inspection or palpation. Alright, so after that, I would ask the patient if he had any questions. I would review my findings. You're very healthy. I did not note any abnormalities in your assessment. Do you have any questions?
No.
Okay. And then I would, report my findings to the physician, and that would complete our exam. Thank you.
Actually, I have a question.
Yes.
What's this anal rash that I have?